Ovine artificial insemination. Artificial insemination, also known as AI, is the process of collecting sperm cells from a male animal and depositing them into the reproductive tract of a female. AI is commonly used instead of natural mating in many species of animals because of its benefits. These benefits include increased safety of the animal and producer, increased production efficiency, and better genetics. Natural mating is a stressful process that has a much higher tendency to result in injuries or accidents of both animals and producers. It reduces the risk of transmitting diseases. The entire AI procedure is much more hygienic than natural mating. All the tools and equipment are sterilized both before and after. The entire procedure is altogether a much cleaner and sanitary process. Increases efficiency, which allows the use of genetic material from males separated by distance or time to overcome physical breeding difficulties, to control the paternity of offspring, to synchronize births, to avoid injuries incurred during natural mating, and to avoid the need to keep a male on farm. It can also drastically improve the genetics of your herd. This gives producers the opportunity to select what they want to breed their animals to. Proven and better genetics are becoming readily available across the nation, and the quality of livestock continues to increase. Well-skilled labour, mainly shepherds or inseminators, well-prepared rams of good quality, used with good body condition, the necessary equipment and tools, along with good hygiene. Some of the tools that are necessary for the AI process include an artificial vagina, thermometer, catheter, a microscope, and pipettes. Applications of artificial insemination in small ruminants is dependent on the choice to inseminate with fresh or frozen semen. Vaginal or cervical insemination techniques with fresh semen are found to achieve acceptable pregnancy rates. However, only laparoscopic or transcervical intrauterine insemination techniques will achieve acceptable pregnancy rates from frozen semen use. This is because in the process of freezing semen, cryopreservation reduces viability and motility. Therefore, as a consequence, less sperm is able to travel past the cervix. Therefore, the only way to achieve high pregnancy rates from frozen semen is to deposit directly into the uterine lumen, close to the site of fertilization. Should frozen semen be used in vaginal insemination, conception rates of 5 to 15% will be observed. However, with laparoscopic insemination, better and more consistent pregnancy rates can be achieved. It is imperative that the ewe is inseminated at least 12 hours after the onset of estrus. The standing practice in use for vaginal insemination is to visually detect the animal is in heat in order to know when to inseminate. However, in most cervical insemination programs, hormonal control of estrus using progesterone treatments are used. The 4 types of inseminations that are used are vaginal, cervical, laparoscopic intrauterine, and transcervical intrauterine. Vaginal insemination. Although with vaginal insemination the procedure is very fast and easy to perform under field conditions, it makes insufficient use of semen and may result in pregnancy rates of 30 to 50%. Cervical insemination allows conception rates of 40 to 80%. Laparoscopic intrauterine insemination. This method requires a lower number of sperm for each insemination, allowing for more dilution rates, thus better preserving and protecting the sperms during the cryopreservation. Here conception rates are 60 to 80%, which are similar to natural mating after an estrus control. However, there are many disadvantages towards applying this within a sheep system, including expensive equipment, invasive surgery, and increase in technical expertise of performing a procedure. Transcervical intrauterine insemination. This method allows semen to be deposited deeply within the uterine horns without the need of invasive surgery. However, the process of manipulating the catheter through the cervix has been linked to reductions in pregnancy rates, possibly caused by cervical trauma. Experienced technicians may be able to achieve the pregnancy rates of 40 to 80% using fresh semen and 30 to 70% using frozen semen. To conclude, artificial insemination is an effective tool to improve the genetic improvement in sheep. It also extends the usefulness of a genetic superior individual in space and time. The current challenge is to improve conception rates per insemination to achieve optimal production goals.